Hello there, my name is Samantha Merritt. I'm a women's health nurse practitioner at the NorthShore in DeMont, and you are watching Ask the Expert. Today we're going to talk about sexually transmitted infections, or STIs. You may also know them as sexually transmitted diseases, or STDs, different terms that mean the same things. So some of the more common ones you may have heard of are gonorrhea, chlamydia, trichomonas, HIV, syphilis, herpes. There are certain people who are at a higher risk for getting STDs. These are people who are under the age of 24. If you have a prior history of getting an STI, if you use illicit drugs or alcohol, but anytime you have unprotected sex, you can get an STI. So with that, it's not just penetrative vaginal sex, it could be anal, oral sex, and actually just skin friction can cause these kind of diseases. The symptoms can vary depending on what type of sex you had. It could be oral, anal, vaginal, and again, the skin to skin friction, or you may not have any symptoms at all. Some common symptoms that we see are vaginal discharge, pain with intercourse, irregular periods, pain bleeding after sex. You can have a lot of throat pain after oral sex, or anal pain or bleeding after anal sex. Ways to prevent sexually transmitted infections. So birth control is a wonderful tool for preventing pregnancy and regulating your period, but no form of birth control, so no pills, patches, rings, IUDs, Nexplanon protect you against sexually transmitted infections. The only way to protect yourself is to use things like condoms. So there's male condoms, female condoms, there's dental dams, and actually latex underwear. That's going to give you that barrier protection to help prevent that kind of fluid transfer or cell transfer that can cause these infections. Some of these infections we can treat with antibiotics. Some never go away and they're kind of just your friends for life. With that, even the ones we treat with antibiotics can have lasting effects. So they can actually decrease your fertility by scarring your reproductive system. So that would be scarring in your uterus and fallopian tubes. You can actually have a very serious infection where the bacteria goes up into your uterus and you can be hospitalized for that. So to protect your fertility, I strongly recommend getting checked yearly for STIs and making sure you're using barrier protection when you have intercourse for any and all encounters. Here at NorthShore, we do offer testing and counseling, and you can check us out at northshorehealth.org.